of it as gender reassignment. It's getting them their correct gender, the gender that they've felt all along in their own heart of hearts, and oftentimes that their family has felt is their appropriate gender. So it's gender confirmation.
There's a rising epidemic of young folks thinking they were born in the wrong body. These young people are often prescribed dangerous hormone treatments. Puberty blocking drugs are given to children that haven't even hit their teens yet. Long-term studies have not shown that these treatments are safe or effective. Hormonal treatments for children are experimental. There are no scientific studies or medical research available that provides information on the health effects of hormonal treatments in children and teenagers. Kids are also undergoing surgery. Girls losing breasts at 13, uterus at 16, boys at 15 can have their penis and testes removed. And we don't know the full impact of these life-altering surgeries. Despite the minimum age for gender reassignment surgery being 18, on July 24th of 2014, Beverly Hills plastic surgeon Gary Alter performed male to female sex reassignment surgery on a 16-year-old California high school student who is allegedly the youngest transgender patient in U.S. history to undergo this procedure. However, a study by Dr. Christine Milrod and Dr. Dan H. Karasik, published in the Journal of Sexual Medicine in March 2017, revealed some U.S. surgeons have performed vaginoplasties on minors aged 15 to 17 years, despite the typical minimum age of 18 for such procedures. It is important to recognize that gender reassignment surgery is a serious and irreversible procedure. Dr. Fred Berlin of Johns Hopkins Hospital has stated that suicide rates among individuals who have undergone gender reassignment surgery are significantly higher, with the rates being 18 times higher than those of the general population.
There have been many cases where it hasn't gone well, people don't pass very well, they don't get the outcome they'd hoped for.
Dr. Fred Berlin is a psychiatrist at Johns Hopkins Hospital. He cautions studies show the suicide rate is notably higher among those who have had gender reassignment surgery.
18 times more than the general population committed suicide. That all has to be known ahead of time before making a very big decision, such as removing normal anatomy with the expectation of happiness, when indeed in many cases that happiness isn't going to be there.
Physical transformation is done in a series of surgeries. The face comes first. For a woman transitioning into a man, Dr. Singh may do an implant on the nasal bridge to make the nose stronger, may do fillers around the cheek and jaw to create a heaviness. He uses liposuction to remove breast tissue and to reduce hips and define the arms. That completes what's called top surgery. Genital surgery or bottom surgery is the final irreversible step.
Those women that have been on testosterone, their clitoris will hypertrophy, meaning get larger.
For a man transitioning into a woman, Dr. Singh may do a nose job to make it smaller, do a bone graft on the brow bone to soften the face, also shave down the chin. The final step for top surgery is breast implants. The bottom surgery is very involved, removing most of the genitals and creating a clitoris and vagina.
The medical transitioning of children has become one of the most controversial issues of our time. It is viewed by some as a medical scandal, while others, like transgender individuals, consider it a life-saving treatment. Many young patients experiencing gender distress do not appear to understand that they may suffer serious consequences from long-term hormone use and genital surgery, including permanent surgical scarring from procedures like phalloplasty. Phalloplasty is a complicated set of surgeries designed to create a penis for transgender men, often requiring several surgeries.
My name is Ashton. I'm 2 years post-op RFF phalloplasty and wanted to share a little bit about my forearm scar. So when you get phalloplasty done on stage 2 of radial forearm flap, they end up making a phallus out of your forearm. So as you can see here, we got a big chunk of forearm skin missing here. That was where the phallus was built. So something that I didn't quite understand until I really started healing was that this legitimately has no feeling at all. I did extensive physical therapy, and my physical therapist was like, yeah, you're probably never gonna feel it again. So I legitimately have to be pretty careful with it, because like if I'm cooking and it's really hot, I gotta be careful, because I would legitimately not feel myself if it was too hot, would not feel it if it was too cold. So that's one thing that they didn't prepare me for at all. I literally nothing, no feeling. When you go through phalloplasty, there are a lot of scars that you get. Some are visible, such as your forearm scar. Others are not so visible. My name's Ashton. I'm 2 years post-RFF phalloplasty, and I am going to show you the not so visible scars. So obviously the biggest scar is going to be your forearm scar. We've already talked about that in one video. You can go back and look at my video if you want to learn a little bit more about that. Scars we're going to focus on today are the scars that you can't really see. So if you look from right here, you don't really see any scars. However, when you lift up your leg, you can see a lot of scarring. So right here is where they did my skin graft. That is now the skin that's on my arm. Right here, they took a live artery out of my leg. This leg was swollen for, gosh, months after surgery. And then on the other side here is where they took a couple more nerve endings. And this scar is just not as big. These scars do have feeling in them. I didn't lose sensation in these scars at all. So those are the majority of my scars that I have from phalloplasty. As always, if you ever have any questions, please reach out to me. I'm an open book. And remember, I'm here for you.
The field of transgender healthcare is rapidly evolving. The World Professional Association for Transgender Health, WPATH, formerly known as the Harry Benjamin International Gender Dysphoria Association, has been researching gender identity issues for 45 years. WPATH comprises of a diverse group of professionals, including doctors, psychologists, therapists, and activists. They focus on researching and understanding gender identity and dysphoria while establishing standards of care for transgender individuals. These standards are widely used by healthcare providers to ensure best practices in addressing gender dysphoria. In September of 2022, WPATH released the 8th edition of its standards of care, and people noticed the updated version had removed age guidelines for puberty blockers and gender-affirming surgery, focusing instead on the individual needs of each patient.
What do you say to folks who think that they're being reasonable by saying, why can't children just wait till they're 18?
Adolescence is hard and puberty is hard. What if you're going through the wrong puberty? What if you feel that you are female, but now you're going through a male puberty?
The argument is, well, they're too young to know.
I want to make it clear that for prepubertal children, there are no medical procedures done.
Dr. Rachel Levine stated that no medical procedures are performed on prepubertal children. However, according to kidshealth.org, most females typically begin puberty between the ages of 8 and 13, while most males start between 9 and 14. It is also normal for some children to start earlier or later.
When you speak out against these bills, what do you cite as the harm?
Well, gender-affirming care is medical care. Gender-affirming care is mental health care. Gender-affirming care is literally suicide prevention care.
Interestingly, after the updated version of their standards of care and after WPATH removed the minimum ages for providing gender-affirming medical care, WPATH's global membership experienced a significant decline from January of 2023 to January of 2024. The number of members fell from 4,119 to 1,590, which represents a decrease of over 60%. Medical professionals from WPATH acknowledged that transgender patients may not always grasp the full implications of gender reassignment.
170 pages of documents, conversations with doctors and therapists associated with this group, WPATH. These files call into question whether patients and parents are giving informed consent. Here's a bit of a report from last night. Take a look.
We've got a pediatric endocrinologist who very clearly knows that these young people, these adolescents, cannot understand lifelong sterility. He says when he's talking about fertility preservation with a 13-year-old, it's like talking to a blank wall.
It's always a good theory that you talk about fertility preservation with a 14-year-old, but I know I'm talking to a blank wall. I know I'm talking to a blank wall. And the same would happen for a cisgender kid, right? They'd be like, ew, kids, babies, gross.
Dan Mesker, an endocrinologist, speaking in a WPATH video conference, highlighted that minors might not fully understand the extent of surgeries or puberty blockers.
I think, when we start people on testosterone or estrogen, we try to be as clear as we can about the stuff that's going to be permanent and the stuff that's going to go backwards. So if you start on testosterone, your voice is going to change. That's permanent, but you might get more muscly, but then that's not permanent if you were to stop. I think the thing you have to remember about kids is that we're often explaining these sorts of things to people who haven't even had biology in high school yet. Some of the Dutch researchers gave some data about young adults who had transitioned and reproductive regret. And it's there. And I don't think any of that surprises us. I don't remember any of the numbers or anything. I have a picture of a slide, but hopefully this is kind of something that'll get published in the next while. But, I think now that I follow a lot of kids into their mid-20s, I'm always like, oh, the dog isn't doing it for you, right? Yeah, they're like, no, I just found this, wonderful partner and now we're kids and da-da-da. So I think, it doesn't surprise me, but I don't know still what to do for the 14-year-olds. The parents have it on their minds, but the 14-year-old, it's like talking with diabetic complications with a 14-year-old. They don't care. They're not going to die. They're going to live forever, right? So I think when we're doing informed consent, I know that that's still a big lacuna of that we do it. We try to talk about it, but most of the kids are nowhere in any kind of a brain space to really, really, really talk about it in a serious way. That's always bothered me, but we still want the kids to be happier in the moment, right?
But in this field, this is all new. This is all contentious. And that's where we run into problems because everyone's afraid. And I know for a fact, people, even adults, even well-educated, older adults accessing care for the first time, sit down with the person who's going to prescribe their hormones and they look at an informed consent form that says your hormones are going to do this, this, and this. They don't take any of that in because they're so scared that they're not going to get what they need. They just show me where to sign because this is my moment. I got to grab it. And they don't really take in the information. And people also are afraid many times about surgery. And so they can read other people's descriptions about surgery and they'll miss details or they'll miss the most important piece of information for them simply because they're afraid to read it. So this is a problem that we're facing. And this is where I think some of the detransition comes in because the over-medicalization as well as over-binarying as well as just the pressures that people are under because of the opposition creates a dynamic that's very, very hard for all of us to work in. Trans people and clinicians. Very, very hard. So I think these dialogues are crucial. And we need to take them outside of this space, ultimately, as well.
I'll just add one more complication in there is that then if you do have, which doesn't commonly happen, but if you are interested in preserving fertility, then the options for doing that, depending on age and stage of development, also can be, from a medical standpoint, may or may not be possible, but then from a financial standpoint also may or may not be possible. And that's another complexity adds another layer of complexity to these discussions as well. And that's at any age, I guess.
Marcy Bowers, president of WPATH, stressed in an email the importance of patients taking active responsibility for medical decisions, especially those with potentially permanent effects. Marcy Bowers is not only the president of WPATH, but also a transgender woman who transitioned after fathering 3 children. She is an American gynecologist and surgeon specializing in gender-affirming surgeries and has performed over 2,000 vaginoplasties for transgender women. Vaginoplasty involves creating a vulva and vagina by removing the penis, testicles, and scrotum and rearranging genital tissue to form a vaginal canal and external genitalia, including the labia. Marcy Bowers did admit that none of the children she's put on puberty blockers have ever been able to experience an orgasm. She says really at about 0.
The second is was an observation that I had that every single child who was, or adolescent who was truly blocked at Tanner stage 2 has never experienced orgasm. I mean, it's really about 0. I mean, it's really about 0. And it's because they never in their lives are exposed to testosterone. That doesn't change. So blockers prevent the rise of testosterone, and they don't really go on testosterone at or around surgery or into adulthood. And so we don't know. They're going to have this sensation. There's no question about that. But are they going to be able to achieve sexual satisfaction? It's important in relationships. And I know that from my work with female genital mutilation survivors, that the lack of being able to be intimate with a partner is very important. And so this is what really raised the red flag for me, is to say, look, we need to have our eyes open about it. I think it's been beneficial talking about it. I know Joe and many others have reported to me, they've changed their approach a little bit in their informed consent models, and that we're talking about masturbation now. We're talking about, okay, that's an area of the body that's got very dysphoric for you, but you know what? It's all a penis is just a large clitoris. I mean, it's all the same material. It really is. So use it for the pleasurable purposes, partially that it was intended, and we'll see what happens. But these are to be answered questions. So can we avoid puberty and get good adult results? And secondly, how do we assure someone that they're going to be able to be sexually responsive? Do we remove the blockers during the course of their adolescence and let a little bit of puberty come back? Do we delay it a little bit, maybe into Tanner's 3 or 4, maybe before they have their first orgasms? Maybe.
Because of these health concerns for minors, many detransitioners like Chloe Cole, who received puberty blockers during her youth, opposes gender-affirming care for minors. They fear the potential lifelong complications and permanent effects that hormones and surgeries could have on young individuals. So on July 27th of 2023, Chloe Cole testified before Congress. She was sharing her personal experience of feeling like she was in the wrong body and then being diagnosed with gender dysphoria. So at 13, she was taking puberty blockers and hormone replacement medication. She was receiving treatment at a Kaiser Permanente hospital in the San Francisco Bay Area from the ages of 13 to 17. She talks about the irreversible harm that she endured as a result of these treatments for transgenders. Her story was particularly alarming as she recounted her journey of transitioning and undergoing a double mastectomy at the age of 15.
Eventually, a surgeon performed a double mastectomy when I was 15 years old. My breasts are gone forever. They are not growing back, and I still have complications with the skin grafts to this day. I have open wounds on my chest that no doctor has helped me with since. My life was turned into a nightmare because of these procedures. I've been to so many doctors who have looked at me and shrugged, telling me that they have no idea how to help me without continuing the experimentation. I feel like a Frankenstein's monster. My body is never going to be the same.
Chloe Cole says allowing minors to undergo gender transition is one of the biggest medical scandals in the history of the United States.
My name is Chloe Cole, and I'm a detransitioner. Another way to put that would be, I used to believe that I was born in the wrong body, and the adults in my life whom I trusted affirmed my belief, and this caused me lifelong, irreversible harm. I speak to you today as a victim of one of the biggest medical scandals in the history of the United States of America. I speak to you in the hope that you will have the courage to bring the scandal to an end and ensure that other vulnerable teenagers, children, and young adults don't go through what I went through. At the age of 12, I began to experience what my medical team would later diagnose as gender dysphoria. I was well into an early puberty, and I was very uncomfortable with the changes that were happening to my body. I was intimidated by male attention, and when I told my parents that I felt like a boy, in retrospect, all I meant was that I hated puberty, that I wanted this newfound sexual attention to go away, that I looked up to my brothers a little bit more than I did to my sisters. I came out as transgender in a letter I sent on the dining room table. My parents were immediately concerned. They felt like they needed to get outside help from medical professionals, but this proved to be a mistake. It immediately set our entire family down a path of ideologically motivated deceit and coercion. The gender specialist I was taken to see told my parents that I needed to be put on puberty-blocking drugs right away. They asked my parents a simple question: would you rather have a dead daughter or a living transgender son? The choice was enough for my parents to let their guard down, and in retrospect, I can't blame them. This was the moment that we all became victims of so-called gender-affirming care. I was fast-tracked onto puberty blockers and then testosterone. The resulting menopausal-like hot flashes made focusing on school impossible. I still get joint pains and weird pops in my back, but they were far worse when I was on the blockers. A month later, when I was 13, I had my first testosterone injection. It's caused permanent changes to my body. My voice will forever be deeper, my jawline sharper, my nose longer, my bone structure permanently masculinized, my Adam's apple more prominent, my fertility unknown. I look in the mirror sometimes and I feel like a monster. I had a double mastectomy at 15. They tested my amputated breast for cancer. And I was cancer-free, of course. I was perfectly healthy. There was nothing wrong with my still developing body or my breasts, other than that, as an insecure teenage girl, I felt awkward about it. After my breasts were taken away from me, the tissue was incinerated. Before I was able to legally drive, I had a huge part of my future womanhood taken from me. I will never be able to breastfeed. I struggle to look at myself in the mirror at times. I still struggle to this day with sexual dysfunction. And I have massive scars across my chest. And the skin grafts that they took of my nipples are weeping fluid today. And they were grafted into a more masculine positioning, they said. After surgery, my grades in school plummeted. Everything that I went through did nothing to address my underlying mental health issues that I had. And my doctors, with their theories on gender, thought that all my problems would go away as soon as I was surgically transformed into something that vaguely resembled a boy. Their theories were wrong. The drugs and surgeries changed my body, but they did not and could not change the basic reality that I am and forever will be a female. When my specialists first told my parents that they could have a dead daughter or a live transgender son, I wasn't suicidal. I was a happy child who struggled because she was different. However, at 16, after my surgery, I did become suicidal. I'm doing better now, but my parents almost got the dead daughter promised to them by my doctors. My doctors had almost created the very nightmare they said they were trying to avoid. So what message do I want to bring to American teenagers and their families? I didn't need to be lied to. I needed compassion. I needed to be loved. I needed to be given therapy to help me work through my issues, not affirm to my delusion that by transforming into a boy, it would solve all my problems. We need to stop telling 12-year-olds that they were born wrong, that they are right to reject their own bodies and feel uncomfortable with their own skin. We need to stop telling children that puberty is an option, that they can choose what kind of puberty they will go through, just so they can choose what clothes to wear or what music to listen to. Puberty is a rite of passage to adulthood, not a disease to be mitigated. Today, I should be at home with my family celebrating my 19th birthday, and instead I'm making a desperate plea to my elected representatives. Learn the lessons from other medical scandals like the opioid crisis, to recognize that doctors are human too, and sometimes they are wrong. My childhood was ruined along with thousands of detransitioners that I know through our networks. This needs to stop.
Chloe Cole has not always been welcomed with open arms when sharing her story as a detransitioner. Some in the transgender community feel that detransitioners overlook the warnings, as some doctors do inform transgender individuals about all the risks and side effects.
Guys, they didn't give me enough information. I had no idea that this is what trans was gonna be. Look, see, this is testosterone. Hold on, I'm gonna open it. Now, are you sure this is everything that's gonna happen to me? Are you sure? Secondly, when you go to the doctors, they want you to go to a fucking therapist. They're like, we need a referral letter. Make sure you're actually trans. And then when you go to the doctors and you're like, okay, I have my papers, this is everything. They give you a form that is like 30 pages long that they want you to read through and sign. They're like, okay, this is what's gonna happen to you. Bruh, at this point, just say you can't fucking read, because what?
I hate when detransitioners come on here and say stuff like, ooh, this is the dark side of testosterone. These are the side effects of testosterone that they don't talk about. Like, yeah, they do. Did you ever do any fucking research yourself? Did you, even read anything that they gave you? Did you read the packets they gave you that you're supposed to read? Like, did you do any research on, side effects? It's your own goddamn fault.
Chloe underwent a series of treatments, including puberty blockers, using a drug called Lupron.
But Ms. Cole, was one of those puberty blockers that you were prescribed Lupron?
Yes, I was put on Lupron.
And what was the purpose of that in your hormone treatment?
Just to stop the natural production of my hormones to make way for the exogenous testosterone.
What age were you when they put you on puberty blockers?
I was 12 years old.
12 years old, doctors gave you a drug called Lupron. Debilitating pain. My husband can attest to it. I would, curl up in a ball in bed and cry. And
Becky Novak was being ravaged by endometriosis, a condition that causes pelvic pain, irregular bleeding, and the risk of infertility. A doctor prescribed surgery, followed by an injection of Lupron, but for Becky, the solution was just as bad as the problem.
If I had known that it was between the side effects of Lupron or endometriosis pain, I definitely would have preferred the endometriosis pain, because the side effects from that medication were just absolutely awful.
Amy Courtney was just 13 years old when she was injected with Lupron. She feels the effects to this day.
I lost hair. I had dental issues. My gums were bleeding. I fell into a really bad depression and bone issues, joint pain, and this has been going on for 20 years. It has not stopped.
It wasn't until 2017 that information on the risk of psychiatric events and convulsions was added to the prescribing information for Lupron used in children. Both Amy,
It makes me so furious,
and Becky say they were in the dark about risks.
I was just trying to make my life normal by getting the surgery and getting the shot afterward, and it's been anything but normal.
The FDA's database currently lists more than 25,000 adverse events associated with Lupron, including suicidal thoughts, vision loss, and excruciating pain, even deaths. I started investigating Lupron in 2009.
Right now, my face is numb, my shoulders are numb, I feel dizzy. I just don't ever feel good.
Several patients have sued Lupron's maker, Takeda Abbott Pharmaceuticals, now known as AbbVie, and the FDA did require several changes to add more side effects to Lupron's label, but many say that is not enough. Dr. John Garigian, who spent 20 years reviewing drugs for the FDA, stated in federal court papers a decade ago that the manufacturer intentionally suppressed knowledge about the real danger associated with the use of Lupron, misleading both prescribers and patients. He also said their studies were inadequate.
Dr. Rachel Levine, a pediatrician and former Pennsylvania Health Secretary, was appointed by President Joe Biden as the Assistant Secretary for Health on January 19th of 2020, making her the first openly transgender federal official to be confirmed by the Senate. She plays a significant role in health decisions for transgender kids, and she definitely supports gender-affirming care. During her confirmation hearing in February of 2021, Senator Rand Paul asked Dr. Levine if minors are capable of making the life-changing decision to change their sex and take puberty blockers. Dr. Levine did not provide a direct yes or no answer.
Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I would look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
The specific question was about minors. Let's be a little more specific since you evaded the question. Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? You have said that you're willing to accelerate the protocols for street kids. I'm alarmed that poor kids with no parents who are homeless and distraught, you would just go through this and allow that to happen to a minor. I would hope that you would have compassion for Kira Bell, who's a 23-year-old girl who was confused with her identity. At 14, she read on the internet about something about transsexual. She thought, well, maybe that's what I am. She ended up getting these puberty blockers, cross-sex hormones. She had her breasts amputated. But here's what ultimately she says now. And this is a very insightful decision from someone who made a mistake but was led to believe this was a good thing by the medical community. I made a brash decision as a teenager, as a lot of teenagers do, trying to find confidence and happiness, except now the rest of my life will be negatively affected, she said, adding that the medicalized gender transitioning was a very temporary, superficial fix for a very complex identity issue. What I'm alarmed at is that you're not willing to say absolutely minors shouldn't be making decisions to amputate their breast or to amputate their genitalia. For most of our history, we believe that minors don't have full rights and the parents need to be involved. So I'm alarmed that you won't say with certainty that minors should not have the ability to make the decision to take hormones that will affect them for the rest of their life. Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and talk with you and your staff about the standards of care and the complexity of this.
Let it go into the record that the witness refused to answer the question. The question is a very specific one. Should minors be making these momentous decisions? For most of the history of medicine, we wouldn't let you have a cut sewn up in the ER, but you're willing to let a minor take things that prevent their puberty, and you think they get that back? You give a woman testosterone enough that she grows a beard, do you think she's going to go back looking like a woman when you stop the testosterone? You have permanently changed them. Infertility is another problem. None of these drugs have been approved for this. They're all being used off-label. I find it ironic that the left that went nuts over hydroxychloroquine being used possibly for COVID are not alarmed that these hormones are being used off-label. There's no long-term studies. We don't know what happens to them. We do know that there are dozens and dozens of people who've been through this who regret that this happened and a permanent change happened to them. And, you know, if you've ever been around children, 14-year-olds can't make this decision. In the gender dysphoria clinic in England, 10% of the kids are between the ages of 3 and 10. We should be outraged that someone's talking to a 3-year-old about changing their sex.
Dr. Levine did, however, speak against states banning or limiting access to the alleged evidence-based standards of care for transgender youth.
There have been attempts in Texas and other states to actually limit access for transgender and gender diverse youth to evidence-based standards of care. To evidence-based standards of care.
Tell me a journal that has done systematic reviews that cites different evidence, that cites strong evidence for benefits of these therapies.
The standards of care were developed based on extensive.
You're not telling me any journal, you're not telling me any study. Don't say standards of care.
Yeah. So
tell me one.
The standards of care.
That's the standards of care.
Yes,
That's not a journal. That's not a study. That's not an organization. That's not an institution. You're just saying words. Name one study.
We really want to base our treatment and to affirm and to support and empower these youth, not to limit their participation in activities and sports, and even limit their ability to get gender affirmation treatment in their state.
Dr. Levine was previously married to Martha Peasley Levine. The couple divorced in 2013, and they have a son and daughter together. In an interview, Dr. Levine expressed no regrets about waiting to transition, stating that if she had transitioned when she was young, she wouldn't have her children, whom she cannot imagine life without.
But I have no regrets, because if I transitioned when I was young, and I wouldn't have my children. I can't imagine a life without my children. And so every experience led me to here. And so how could I regret that?
An October 2023 Yahoo Finance article projected that the global sex reassignment surgery market would increase from $2.9 billion in 2022 to $6.26 billion by 2030. Shane Taylor from the Vanderbilt University Medical Clinic has highlighted the substantial income their hospital earns from checkups for transgender patients, medications, doctor visits, and surgeries. She actually did a lecture where she talked about how much money these surgeries make for the hospital.
January 1st of 2017, according to the Affordable Care Act, insurance carriers are mandated to cover medical expenses for trans folks. Some of our VUMC financial folks in October of 2016, started a couple of years ago, put down some costs of how much money we think each patient would bring in. And this is only including top surgery. This isn't including any bottom surgery. And it's a lot of money. These surgeries make a lot of money. So female to male chest reconstruction can bring in $40,000. A patient just on routine hormone treatment, who I'm only seeing a few times a year, can bring in several $1,000s, because that requires a lot of visits and labs. It actually makes money for the hospital. Now, these I got from the internet, but it's from the Philadelphia Center for Transgender Surgery, which does a lot of surgery for patients. And I just want to give you an idea of how much these bottom surgeries are making. And I think this has to be an underestimate. This is for a vaginoplasty. They're quoting roughly around $20,000 for a vaginoplasty, but that doesn't include your hospital stay. That doesn't include your post-op visits. That doesn't include your anesthesia, your OR. So I would think that this has to be a gross underestimate. I think that's just like the surgeon's piece of it, which anybody who's ever been in the hospital knows that that's like 10% of it. And then the female to male bottom surgeries, these are huge money makers. Again, I think this has to be an underestimate that they're quoting around $20,000 for a phalloplasty. There's been different things that I've read that said it could be up to $100,000. Dr. Winokur, who's our surgeon, says that there's entire clinics where the entire clinic is supported just by their phalloplasties, and that is like a fraction of the surgeries that they're doing. These surgeries are labor intensive, they require a lot of follow-ups, they require a lot of OR time, and they make money. They make money for the hospital.
The medical harms are serious. Hormonal treatments impact bone health, fertility, sexual function, cardiovascular health, and brain development. The health consequences may be irreversible. The full extent of the harms to young developing brains and bodies are unknown.